Good morning, everyone. We're going to take a look at disruptive innovation. Disruptive innovation, a term to describe how industries are transformed by companies that provide products and services that are dramatically more accessible, convenient, and affordable for customers. In the healthcare sector, disruptive innovation primarily involves transferring skills from highly trained, expensive clinicians to more affordable providers, including technology-based care. Site shifts from hospitals to outpatient, home, and even virtual settings. Today, we're going to take a look at a disruptive innovation company by the name of CareZone, marketed as a private network for the world's oldest social network, the family. While looking at the organization, we're going to look at the service overall, see how it could be a threat to existing healthcare organizations, and the partnerships it may have with existing healthcare organizations. CareZone is a web-based program that also has a smartphone application that allows the user to coordinate all of their family's medical needs, like the program LifeLock. This is a super private cloud-based program designed to help families easily share important information with loved ones and caretakers who need it, from keeping track of medications and doctor's appointments for all of the family members to insurance information, addresses, phone numbers, even prescription information. This program is designed to make everyday decisions concerning healthcare easier and give the user more control over all areas of their healthcare. Fully HIPAA compliant, this program allows the user to take photos of medication labels, store discharge instructions, advance directive, even copies of photos of important documents can be stored in the cloud using CareZone. It brings everybody together in a protected, encrypted environment. Think of it as your virtual safe deposit box. But that's not all. This program can also be used to send messages to all family members instantaneously. Imagine how much simpler it would be if you can record one message saying dad had a stroke and where he is hospitalized, and everyone in the family gets it instead of having to make a dozen phone calls. While this program is fully HIPAA compliant, we have to ask ourselves, how safe is safe? Breaches in healthcare data are more than just IT concerns or PPR damage control cases. They undermine patient trust and harm the provider's goodwill, and consequently their bottom line. While technology provides certain safeguards to secure patient data, at the end of the day, it's humans who build security into organizations' culture. Billing and insurance records and medical files are the data most likely to be stolen from a healthcare organization. Criminals who access health information gain much more than a credit card number. They have lab results, medication, medical records, insurance numbers, and even PIN numbers and security questions that patients use to protect their information. They are, in fact, stealing enough information about our identity where it would be very difficult for anyone to prove that you are not that person should the extremely personal information be compromised. This could harm not only the patient but the hospital, labs, and other facilities where the patients are seen. As it was said earlier, enough information can be taken that it could be difficult for anyone to prove that the hacker is not indeed that person. Fortunately for us, CareZone has considered this, and their security is top notch. From their website, we are told that we use many of the same techniques that are standard at banks and major corporations to protect our systems. All communication between your web browser and our system is encrypted. So when you're on an insecure network at an airport or coffee shop, nobody listening can snoop on your data. Our storage and servers are redundant. So if something fails, we can recover quickly. Data is written into multiple places immediately, and we make encrypted off-site backups several times a day. Uploaded files are stored in Amazon S3 storage system, which is an industry leader in security and reliability. To protect against accidental disclosure, we use government standard AES encryption when data is at rest. Our application servers are on a private network isolated from the internet. They reside in a physically secure data center, which is monitored 24 hours a day. We keep up to date with security patches and report vulnerabilities. CareZone is a highly engaging, HIPAA-compliant platform people use daily. Their partners leverage CareZone to create new products, service, and resource offerings and to engage with users to assist with their caregiving needs. CareZone partners with healthcare providers to reduce visits and repeat visits, improve outcomes, and provide insight into patient activity between appointments, insurers and employers to collaborate on building healthier habits and reduce the cost of healthcare, pharmacies and PBMs to encourage accurate and timely prescription refills, and nonprofit disease organizations to give those affected with chronic disease easy access to the CareZone platform for taking care of their loved ones. In conclusion, CareZone is a HIPAA compliant platform used daily by people to keep track of the important things. It allows the user to keep all important, valuable information in one place. The creators, being fully aware of the dangers of this information leaking, have taken measures above and beyond to make sure information is not only safe but stays that way. Not only that, they made sure that if the servers ever go down for any reason, there are redundancies built into the process that allow the information to be retrieved unharmed. In the overall scheme of things, this platform would be a godsend to multiple family members dealing with medical issues, or even with one family member with multiple medical issues. Thank you for your time, and I hope you have a wonderful day.